Good evening. I'd like to call to order our work session this evening. I hope that we'll have a robust conversation and give good direction related to homelessness and how we will address this opportunity in our community. And with that, City Manager.
Thank you, Mayor. Mayor and Council, homelessness, as you know, across the valley has increased for a variety of reasons. The City Council approved the use of CARES dollars, and along with the additional CDBG CARES funds, we have definitely been able to add some very needed resources in this particular area in the community. Without these resources, it is going to be extremely challenging to develop and maintain strategies regarding homelessness in Chandler. Today, Leah Powell, our Neighborhood Resources Director, and her staff will present to you strategies we have in place, present to you upcoming concerns regarding the rising number of homeless, and at the end, I would appreciate discussion regarding support for these programs and your thoughts regarding resources as we approach the possible end to some of these currently available dollars. And I think Leah's got some actually better news today on that. So with that, Mayor, I'll hand it over to Leah.
Good afternoon, Mayor and Council. Thank you so much. You know, when we come up here to talk about general fund allocations or community development block grants, often the question about homelessness comes up, discussion about homelessness. So I really appreciate this extended time this afternoon to be able to dive a little more in depth into the conversation and really have that dialogue back and forth regarding homelessness in Chandler. What we're going to do tonight, we're going to go through the following things in our agenda. We'll talk about the background, both on the regional level as well as specifically in Chandler, the services that we're currently offering, the funding, how we are funding those services that we offer today, and strategies and challenges. And these strategies and challenges will also look into the future and what we feel like are some of the future needs, which of course also goes back into our immediate needs, because as Marcia had indicated, we are certainly taking a look at all of the funding that we receive, and I do have some good news that I will share later on, but we also have to be aware of when funding will run out. So we will cover that later on in the presentation. At this point, I'd like to ask Ryan Balch to come up, and Ryan's going to cover some of these, and I will be back when we get to strategies.
Good afternoon, Mayor and Council. I too am really happy to be here to dive a little deeper into this subject with you today. So we'll just start out with some basic overview. What is homelessness? How is it defined? Homelessness literally means lacking a fixed, regular, adequate nighttime residence. It does not necessarily mean unemployed, mentally ill, addicted, or criminal. The majority of people with these conditions are in fact housed. In addition, very few people are homeless by choice. This is a misnomer generally predicated by mental illness. There is, however, a portion of the population who are defined by a presence of a disabling condition and a consistent or persistent homelessness. This group, who we refer to as chronically homeless, make up 20 to 25% of the population, but utilize a disproportionate amount of resources because of their acuity or high level of need. Why are people homeless? There are as many unique reasons people are homeless as there are persons experience it. Everyone really has their own story. But there are several primary reasons we can both point to and do something about. First, it's important to acknowledge the inextricable link between homelessness and poverty, and likewise the link between poverty and systemic discrimination. Another contributing factor is the disconnect between wages and the cost of housing. They simply are not rising at the same rate. As a result, there is a shortage of affordable housing, which is defined as housing that costs 30% or less of a household's income. This is the housing wage, or the hourly wage needed to afford a modest 2-bedroom apartment in Maricopa County, is $20.63. This is $9.43 more than the minimum wage. There are also many barriers to mainstream housing, which means housing is not equally accessible to everyone. We'll explore this a little bit further as we go forward. Unmanaged behavioral health conditions, and by that I mean mental illness and addiction disorders, can also make it challenging to obtain and maintain housing. Finally, natural support systems, think family, friends, coworkers, can often be the difference between keeping a roof over your head and losing it all. As I just mentioned, housing is not equally accessible. Once the cycle of instability begins, one thing leads to another, and it's hard sometimes to keep your head above water. To demonstrate this, I'd like to introduce you to Jeff and Julie, their dog Louie, and their cat Goose, who's not in this picture. Jeff and Julie are not actually Jeff and Julie. We've just changed their names to keep their privacy. This photo was taken the day I met them in early 2018 at their encampment off of Roosevelt and Fry. Jeff has never been housed a day in his life. He grew up in a family who was homeless. As such, he has no income, he has no credit history, he has no employment history. He does, however, have a myriad of undiagnosed conditions, a petty criminal record, and an addiction disorder. Julie was married with children, but fled the relationship, which was abusive. She left everything, including her full-time job, behind. Jeff and Julie met on the streets and have lived together in the East Valley for the last 7 years. The last 3 have been here in Chandler, primarily behind the Costco on Galleria Way. Without income, Jeff and Julie are unable to rent an apartment. Without an apartment, they're unable to obtain employment. Without employment, they're unable to address their healthcare needs. And without healthcare, they're unable to do the myriad of things that we expect in mainstream society. And the cycle just goes on and on. Jeff and Julie are also unable to utilize the emergency shelter system for a number of reasons, including their desire to stay together, their reluctance to part with their pets, and untreated behavioral health conditions. We're going to come back to Jeff and Julie in just a bit. To add to its complexity, homelessness is an issue without geographic borders. For this reason, we address homelessness in partnership with our friends and neighbors across the region. As a city, we're very active in the Maricopa Regional Continuum of Care Governing Board, which makes policy decisions about how the bulk of federal resources dedicated to addressing homelessness are allocated, and how the homeless service delivery system works for the entire Maricopa County region. We also participate in the East Valley City Managers Committee, which was formed to work towards specific solutions for the East Valley. As a starting point, we entered into a joint resolution to collaborate towards solutions in August 2019. And finally, we convene a citywide group that we affectionately refer to as IHOT, which stands for Interdepartmental Homeless Operations Team. This group serves to address the impacts of homelessness on public services and also to ensure that people experiencing homelessness can easily access public services. Speaking of joint efforts, the City of Chandler participates in the regional count of persons experiencing homelessness each year. The point-in-time count, or the PIT count, is a one-night snapshot of sheltered and unsheltered homelessness. There are many more people who experience homelessness over the course of the year, but the PIT count is helpful for understanding trends and needs related to system capacity. This graph depicts the trends in Maricopa County over the last 5 years. The overall unsheltered count for our region has been increasing each year. In 2020, for the first time, more persons were living on the streets than were living in shelter. The trends are similar here in Chandler. Over the past 5 years, the number of persons experiencing unsheltered homelessness has increased 142%. In Maricopa County as a whole, it has increased 192%. As a point of reference, Chandler's number of persons without shelter is 3 times the number of shelter beds we have in our community. These graphs depict the composition of the 7,419 residents experiencing homelessness that were counted in Maricopa County in 2020. 61% of the population identify as male, 39% as female, and less than 1%, but still 21 people, as transgender or gender nonconforming. This has really remained consistent over the years. The percentage of males at 61% is larger than that in our general population in Maricopa County, which is 49%. The largest group is adults over the age of 25 who account for 76% of the population experiencing homelessness. Children ages 0 to 17 make up 17% of the population, and youth age 18 to 24 make up 7%. 87% of persons counted in 2020 were single adults, 7% were persons in families, and 6% were unaccompanied youth. It's important to note, though, that we know that the number of families is very low because they're very difficult to count. Mayor?
So Ryan, a quick question
Yeah.
on the center age groups, and that are most of the 17% living, that represents families as opposed to, is there any stats on children on their own?
That 17% is actually, yeah, children in families. Yes, we are going to talk about youth on their own. At 6% are the youth that are not with families, the unaccompanied youth.
That would be the gold color or the orange color, or is that part of the blue?
That is a good question. I'm not actually seeing them show up on the graph here. It says 7%, 530.
Okay,
So maybe my number's wrong in my notes.
so it doesn't, most of the children are with families, I guess is my question.
Most
Is
of the
that
children
wrong?
are with families.
Great. Thank you.
Yeah, only 6%, or it might be 7 on the streets by themselves. Yeah. Over the years, the ethnic breakdown has remained very consistent. Most people identify as non-Hispanic or non-Latino. By race, there has been a slight increase in white and African American populations and a slight decrease in people identifying as multiple races. The 2020 PIT count shows significantly higher percentages, however, of African Americans and American Indian Alaskan Natives than there are in the general population. For instance, in the PIT count, 27% of the population was African American, but in the general population, only 6% are African American. The growth rate has also been increasing over the last 5 years. Between 2019 and 2020, the growth rate for persons without shelter in Maricopa County was 18%. Unfortunately, we anticipate this trend will continue as we weather the economic impact of the pandemic. Research is starting to emerge about the impact of COVID-19 on homelessness. National estimates predict 30 to 40% increase in homelessness based on variables like unemployment and the cost of housing. We believe here in Arizona, it will be even higher because of our high rate of evictions. Dennis Culhane, who is a prominent researcher out of the University of Pennsylvania in the area of homelessness, chose Phoenix as one of the cities that will be whose homeless population will be severely impacted by COVID-19. As we've spoken before, people experiencing homelessness are particularly susceptible to COVID because of their advanced age, their inability to shelter in place, and their accelerated physical decline and something we call mental weathering in the industry, which is a result of being out in the harsh elements consistently. One of the indicators that we're watching very closely right here in Maricopa County is the number of heat-related deaths. It appears this number will be much larger this year than in previous years, and we believe this is because of people's inability to go into air-conditioned space with a shutdown. As discouraging as this is, we do have some good news. You might remember Jeff and Julie from a couple slides ago. I met them at their encampment. This is a picture of them just a few weeks ago signing lease agreements for permanent supportive housing. So what changed? The addition of a new service we were able to implement in response to COVID-19. I'll be telling you a little bit more about that in a moment as well. So the anticipated increase of homelessness is really a major concern. Without stable housing, persons experiencing homelessness cycle in and out of emergency rooms, inpatient hospital stays, psychiatric centers, detox programs, and jails, which results in high public costs and poor health outcomes for the individuals, including, and we've seen this over and over, premature death. Conservatively, persons experiencing homelessness utilize between $30,000 and $50,000 a year in public services, just being on the street using those services. On the other hand, it only costs us $15,000 a year to provide permanent housing and wraparound services. In addition, people who are chronically homeless utilize a disproportionate amount of public services. This is why the current trend is to prioritize resources to the most acute individuals. It's both imperative to their health and welfare, and it makes economic sense. So now that I've provided a little bit of background, and I can pause here if you guys have any questions, I'm going to move into a little bit of how Chandler's treating homelessness, what our strategies are.
Mayor,
Councilmember Wong.
I saw a few homeless people with cellular phone
Yeah.
at hand.
Mhm.
So who give them the cellular phone if they don't have any income?
Yeah, that's an excellent question through the mayor, councilman. I can't guarantee it, but it might very well be that they are a part of our program. One of the very first actions we took when the shutdown occurred was to provide some of our clients that are working very closely with us cell phones. And we did this through a partnership with T-Mobile. The reason we did that was because at that moment in time, we weren't sure how we were going to stay in contact with our clients if we could not come in contact with them. At that moment, we weren't sure if our outreach worker, who is here today, by the way, this is Misty Gustafson. She's an amazing person, and we'll see that a little bit more as we talk about outcomes. But we didn't know if she could go out on the streets and work with people. So the first thing we did was look for this partnership that some other cities had tried, and it's been working really well. I want to say we have the ability to hand out 40 cell phones. I'm not sure exactly how many are out there at the moment, but it's working really well. So our office is still closed, and so this is one of the primary ways that Misty is able to contact people experiencing homeless to make sure that they get to their appointments, to come see her, to go search for housing, and it's one of the primary ways they contact her when they're having a crisis. Mhm.
Also, I also see people on wheelchair, and somebody was pushing them. But well, I was curious, so I actually asked them, are they related or anything? It doesn't look like they are related. Do we also provide that kind of service to them, or they just help themselves?
Through the mayor, Councilman Wong, we don't provide wheelchairs, or do you mean like the service of pushing them around?
Yes.
Yeah, no, that's not something that we would do. I'm guessing those were probably friends or family assisting
Okay.
each other. Yeah.
Okay.
The
But
homeless
I'm very
community
sure they are
tends to be
homeless.
very
Yeah.
helpful to each other. Yeah.
Okay, thank
And
you.
there are quite a few people out there who have physical disabilities.
And I also know we've had, there's several other organizations that do provide phones. I know when we used to do those quarterly events, kind of a wraparound service, there were at least 2 organizations there that were handing out free phones. So don't even know if those are ours, but
Yeah.
at least there had been resources available from other organizations offering phones to the homeless community.
We haven't seen that program in quite a while.
Okay.
It seemed to be a program that potentially sunsetted.
All right,
So we were glad to have this opportunity to do that.
good. Please continue.
Yeah, okay. So like I said, we're going to talk a little bit about Chandler's strategies at this point. So the first strategy I want to talk about is a really effective one. Simply put, it's to keep people stable in their homes. One of the ways that we do this is through our homeowner rehabilitation program, which we operate in partnership with a nonprofit organization, which is the Foundation for Senior Living. And it's funded through Federal Community Development Block Grant, or CDBG funds. The program primarily supports essential emergency repairs. These are things like when the AC breaks or the roof has a leak, and it's for homeowners with low and moderate income. We can also make external repairs that might be required by an HOA so that a homeowner can avoid fees, and ADA improvements, which are necessary for their safety and mobility in their home. Next, and this one is more important than ever in this pandemic environment, we prevent evictions through rent, mortgage, and utility assistance. Currently, we are providing both general and community development block grant coronavirus, or CDBG-CV funds, to 2 Chandler nonprofit organizations, Ascend and the Salvation Army, who then provide this service directly to residents in need. We anticipate that the need for this service will continue to increase as the growing economic impact of the pandemic becomes more apparent. When homelessness cannot be prevented, we rely on emergency shelter and transitional housing as a safety net. Here in Chandler, our nonprofit partner Ascend operates iHelp, which stands for the Interfaith Hospitality Emergency Lodging Program. And it makes shelter available to up to 25 individuals each night through partnerships with faith organizations in the East Valley. We also support this program with general funds. Mayor.
Councilmember Wong.
Yes, I do have a question about the eviction. I heard from newspaper and TVs talking about because the pandemic COVID-19, so all the eviction is stopped, or what exactly is it?
Yeah.
Would you mind give us a brief?
Absolutely. Through the mayor, Councilman Wong, that's an excellent question. There's been so much talk and information about eviction moratoriums. So where we're at this point is that the CDC, the Center for Disease Control, has put out a federal eviction moratorium through December 31st. So what that means is that landlords cannot evict tenants for non-payment of rent. They can still evict for other reasons if a tenant is not meeting their part of the contract for another reason, eviction is possible. But if it's only because of non-payment of rent, they cannot do that. The tenant implements that by signing a document that says, I qualify for this assistance, and presenting it to their landlord. So what we anticipate, unfortunately, is that come January 1st, we're going to have a lot of people with a lot of back due rent. So our organizations that we have been funding that are receiving assistance right now are reporting a lot of people asking for rent, and it's going really well. They're getting, our organization Ascend is very effective. They're getting lots of money out the door, but some of the dollars, like the county dollars, for instance, it's required that they can prove that COVID impacted them in their ability to pay rent. So they are having a hard time with tenants being able to provide them proof that it was COVID. So it perhaps people who were already sort of on the edge heard about the moratorium and said, oh gosh, thank goodness, I can start to take care of some of my other basic needs and hold off on the rent for a little bit. So we are concerned about that. But for those who do qualify, it's an excellent benefit, and it can be potentially up to 6 months of rent.
So this is probably a little bit politics. Then saying for landlord, the landlord are probably not going to be happy because the landlord
That's right.
still need to pay the property tax, still need to pay the mortgage and other costs.
Yeah.
Right. So is any compensation to the landlord? I understand we are not discuss the landlord.
Oh, that's a great question through the mayor, Councilman Wong. So one of the things that we're doing, and we're going to talk about that very shortly here, is getting the word out to not only residents, but also landlords to say, hey, let your tenant know that this eviction prevention dollar is available, and help your tenant get that dollar, because when the tenant gets the dollar, therefore you will have your rent paid. When we do help a tenant, the money actually goes straight to the landlord. It does not go through the tenant. So we know that our prevention dollars will help landlords. But you're absolutely right. When a tenant doesn't pay, it does hurt landlords. Yeah, you're welcome. Okay. Excuse me while I just find my place here. I think I was talking about iHelp. Is that about right? Okay. So currently at our iHelp, like many shelters around the valley, they've had to reduce their capacity just a little bit to implement physical distancing. So our iHelp, which generally can help about 25 people each night, is currently serving 20 persons each night. And instead of rotating around in the community like they normally would, they're providing this service at one church to make sure that they keep the residents safe and prevent the spread of COVID. We also support 2 East Valley nonprofit organizations through general and federal funds for emergency shelters for families. These are A New Leaf and Save the Family. We also provide support for 2 domestic violence shelters, one here in Chandler and one in Phoenix. As a result of COVID, we've also had the opportunity to support a rapid rehousing program for families, which will help 19 Chandler families who fall into homelessness be quickly rehoused and supported back to independence. This is a service we've been lacking in our regular portfolio, and one that the Department of Housing and Urban Development is really asking communities to ramp up. So we were very pleased that we were able to do this with AZ Cares funds.
Ryan, quick question.
Yes.
When you introduced iHelp earlier, you had changed the acronym that I was familiar with to Interfaith Hospitality Emergency.
Is that
it
not
hospitality or homeless?
Oh, homeless.
Okay.
In some, so iHelp is a term that's used across the nation, and I think some places call it interfaith hospitality, and some people call it homeless. So
Okay.
my apologies.
No worries. I just
Same
wondered if
program.
that had changed. I hadn't
Same
been
program,
told.
only in my brain. Yeah. And then finally, we regularly operate a very successful tenant-based rental assistance program. I often refer to it as TBRA, for persons experiencing homelessness. This program, which is operated in partnership with our Public Housing Authority and Ascend, allows us to serve people that have the potential to maintain independent housing in the future, but need significant long-term assistance in getting to that point. Our next strategy, navigation and client services, is targeted at persons who are experiencing unsheltered homelessness. We use a peer-based model, which means that our community navigators have lived experience in the areas that our clients need assistance with. The navigator's job is to find and engage persons living without shelter in Chandler, build a relationship with them, and then assist them in developing and implementing a plan that will ultimately end their homelessness. This is what I like to call a whatever it takes kind of service. As I mentioned earlier, each person has a unique story, and every plan is tailored to meet their unique needs. Services run the gamut from applying for identification and benefits, to accompanying a person to medical appointments, to reconnecting people with family, to helping them move into their new homes. The navigation and client services staff work very closely with police and fire, as well as other city departments that are impacted by homelessness. Other city departments include community service, who operate parks and libraries, and transit, who operate our bus stops. They also meet with residents and businesses impacted by homelessness on a regular basis to understand their concerns and develop plans to both assist those in need and return the area of concern to its original condition. Later in the presentation, we'll be sharing some of the outstanding outcomes of this program. But first, I want to talk to you about our new Chandler Cares team. Our new team, which consists of Our new team consists of 3 temporary positions funded through AZ Cares dollars. This team has hit the ground running to build a foundation of support for Chandler residents facing the economic and emotional toll of the pandemic. One of their first orders of business is to get the word out to landlords and tenants that financial assistance is available. The postcard you see here, and I think you guys have, are being distributed widely to ensure that residents know help is available. We're also working very closely with the water department to assist residents with past due water bills and to make sure that they get the help they need. Another task they're engaged in is landlord outreach to expand the inventory of housing available to people with subsidies. As you know, housing availability is critical in preventing and ending homelessness. Along those same lines, one of the team members is working to assist vulnerable households to stay stable in their homes. And as a catch-all, we've created a dedicated Chandler Cares resource line and email address to make sure that residents have access to a real person who can assist them in finding the resources they need, whatever that looks like. Another new service we're delivering in response to the pandemic is motel stays to ensure that persons living without shelter have a safe place to shelter in place. This is the service that changed everything for Jeff and Julie. As I mentioned earlier, people experiencing homelessness are at increased risk for contracting and potentially spreading COVID-19. And shelters are not accessible for many people, as was the case for Jeff and Julie. Motel rooms, unlike congregate shelter settings, allow households to be together. They allow pets. They don't have curfew requirements, and they don't require sobriety. Once we were able to provide Jeff and Julie a motel stay, we were able to work with them to take necessary steps to secure affordable housing for them and Louie and Goose. To date, we have provided motel stays for 46 unduplicated Chandler households, many of which, like Jeff and Julie, have moved on to permanent housing solutions. We're extremely grateful to Maricopa County for supporting us in this effort. They support 10 motel rooms and a security guard, and they're doing this through September 30th, but will likely be extending our contract through the end of the year. We're also utilizing CDBG CV funds to support an additional 10 to 15 rooms at any given time. Our community navigators provide the wraparound support services, and our partners at Ascend are providing weekly food boxes to program participants. As I mentioned, we do have security for this program. Our only incident to date was a call for an ambulance for our participant that later ended up in hospice. However, the security guards have been able to assist the motel with incidents not involving our program participants. The Day Respite Center is another new service we've developed as a result of the pandemic. When the pandemic first hit, the public facilities and businesses shut down, we partnered with faith organizations to provide portable hand washing stations and restrooms in their parking lot. We knew access to these services for people living without shelter was essential to not spread the virus. As summer approached, heat became a concern. Traditionally, public facilities, nonprofit providers, and faith organizations will open their doors to people who don't have access to air-conditioned space and water when the heat is extreme. The pandemic, unfortunately, forced us to look for alternate solutions. We were extremely fortunate to find an incredible partner in Compass Christian Church who welcomed this service in their facility. The Salvation Army came alongside them to provide operational support, and on August 17th, the Heat Relief Center was born. Between then and last Friday, the 11th, 45 unduplicated individuals have utilized the center. The highest census on any given day has been 12, and the highest user has also been there 12 times. We have provided 61 showers, 52 care kits, 61 naps during this period. I mention these seemingly nominal services, including naps, because as it turns out, they're really significant. This very low barrier service has allowed us to begin building relationships with chronically homeless individuals who were not previously willing to engage with us. As a result, we've started developing housing plans for people who have been chronically homeless for years. This concept of a year-round, low-barrier respite center is something we'd like to consider further in the future. So the big question, what does this all cost? Currently, with the increased level of funding available as a result of the pandemic, we are spending a total of just over $2.3 million on the services we've been talking about. This graph breaks down that expenditure by service. Our largest investment is in housing stability, which is right where it should be, because housing stability is the long-term solution to ending homelessness. However, we may need to increase emergency services in the immediate future because of the impending crisis. This graph illustrates that same $2.3 million investment by fund source. 67% of the budget for homeless services is one-time COVID-19 funding. Another 30% is competitive general fund and federal CDBG or home investment partnerships funding allocated each year through recommendations by the Housing and Human Services Commission. The federal allocation varies year to year based on the congressional allocations. Another 1% is a one-time decision package you have provided for bridge housing. Bridge housing is also provided via motels, but for different reasons. And finally, 2% is dedicated ongoing funding for a community navigator position, but that doesn't fund the entire position, so we have to apply for competitive funding to make up the difference. In summary, 98% of the investment is one-time or competitive funding, and only 2% is dedicated. So now that you've seen the big picture to include new and expanded programming supported by one-time COVID-19 funds, I wanted to provide a quick summary of where we're at. This is an overview of our current regular strategies not supported by COVID-19. We have 2 community navigators. One is a city employee and one we contract for. We support a small amount of rent and utility assistance, approximately $160,000 a year through our annual allocations process. We also support emergency shelter for singles and families through this allocation process. We support 25 units of TBRA, and as you saw in the last slide, the vast majority of these services are funded through the competitive process and are not guaranteed year to year. This is a summary of services we've expanded to respond to the pandemic with one-time COVID-19 funding. AZ Care funds have allowed us to support 2 additional community navigators, 1 internal and 1 on contract. The internal employee is already on board and she's hard at work. We've also been able to increase support for rent and utility assistance by 4.5 times because of pandemic funds. These are the new services that we've been able to implement because of one-time funding. This includes the motel program, the portable hand washing stations and restrooms, which are still out in our community, increased financial support to nonprofit organizations, including money for additional services, PPE and disinfection, that rapid rehousing for 19 families, and heat relief and day center services, and the Chandler Cares team. So what are we getting for our investment? It'll be a while before the results are in on how our one-time money is spent, but I wanted to share a snapshot with you of what Misty, our first city employee, our first navigator that we hired as a city employee, has achieved in the 7 months since we hired her in February. 11 people were diverted from entering the homeless services delivery system, which means we were able to assist them in getting to another means of support. Often this is a bus ticket to a relative who is willing to provide housing in another state. 5 households have moved into our TBRA program and will work to independence over the next 2 years. 2 additional households are busy searching for housing. 10 people have moved into rapid rehousing, where they will receive move-in assistance and temporary assistance with rent before they're back on their own. 4 additional households are searching for housing for that service. And 7 households have moved into market race housing, where they're paying their own rent, with 2 searching for housing. They're able to do this because of the assistance the navigators have provided in finding them employment or helping them attain the benefits that they're eligible for. In terms of service, as I mentioned, 46 households have come through our motel program. 71 essential documents have been obtained. 13 individuals have received healthcare services. 11 individuals have received mental health care services, and 17 have received addiction services. And this has all been achieved in the last 7 months by 1 homeless navigator. That's what I call a good investment. Now I'm going to turn it over to Leah. Unless you have any questions, I'm going to turn it over to Leah to talk a little bit more about the future. Mayor.
So of that 2.3 that you mentioned, and I know some of that is competitive CDGB and the other that comes from the general, but how much has traditionally a dollar amount the city provided that was not one-time COVID related? What was our baseline in 2018-19?
That is an excellent question, Mayor, that of course I forgot to bring the backup for, but I'll get you that. I'll get you that figure. I do have it calculated.
Okay.
Yeah.
Councilmember Wong.
So the motel stay, how long would be the program?
The motel stay?
How long?
Yeah.
How many months or how many years? Or
Through the mayor, Councilman Wong, that's an excellent question. It really depends on each individual. It also depends on the funding source that we use. So one of the funding sources that we're using for that, the Community Development Block Grant Fund, will not allow us to support someone in that service for over 6 months.
so do you have a number how much money we left for this program?
Through the mayor, Councilman Wong, We have spent, let's see. So on the Motel Bridge program right now, we have $212,000 dedicated towards that service.
Mm-hmm.
And that is various funding sources. And
Okay.
we also have the county's dollars, and currently they're providing us about 79,000. 58 of that is for the actual rent. The remainder of that is for security, but they have verbally committed to us at this point to extend that program through December. So the additional 10 rooms will be provided by them through December. So we'll take full advantage of their dollars.
Do you envision the county dollars that might extend into first quarter, or do you think that'll terminate at the end of the year? Or do you don't have,
Yeah.
if you don't know, that's fine.
I don't know, Mayor. I was really pleased to get the call this week, actually, that they'd like to extend through December.
Good.
I'm not really sure about past that.
Councilmember McClymans.
Yeah, so a couple questions. So in 2016, we had 14 unsheltered homeless. Was that in
Yeah.
Chandler? And so now we're at 75. And so both numbers, while small based on our overall population, I mean, that's exponential growth in homelessness over that time. But during that time period, our population hasn't grown at that rate. And I mean, with the exception of what's happened in 2020, our economy's been improving over that time period. So, I mean, what's the key driver of
Yeah.
that?
Through the mayor, Councilman McClymans, that's a good question. Sometimes, so homeless counts, I always like to say, are more of an art than a science. They really help us with trends more than they help us at any given time. It could have been that year there was bad weather and we only have several hours on the day that's dedicated for that each year to count people. It could be that we had a low count that year, or it could be just a number of things. I wouldn't look at that particular data point. I would look at the trend line, which is sort of why we try to look at 5 years at a time.
Okay.
Yeah.
So, so right now we're at 265,000 population, give or take, whatever the census says, whenever Councilmember Stewart finishes the census. But my question is cities of like 200 to 400,000, is there any model cities that are best practice? Are we that? Cities that are declining over that time?
Cities that are declining. Through the mayor, Councilman McClymans, there are a number of best practices out there, and we are participating in many of them. The tenant-based rental assistance program is a best practice and something actually that many cities around the nation look to us for. We were one of the very first cities to implement that, and we get calls often wanting to know how we do that. One of the things that Leah's going to talk about is the potential addition of permanent supportive housing. Ultimately, the folks that you see that are living on the streets need permanent housing with permanent support. So that is one of the things we might want to add to our portfolio moving forward. I'd say that we're absolutely on the right track. We just need to make sure that we have all of the different kinds of services in place to address all of the needs in our diverse homeless population.
Okay. All right, no more questions.
And I don't think I've missed a day of the homeless count in the last decade in some capacity, but I do think we had about that time, if not that year, we did have a very heavy rain going on, and just
Yeah.
people were hunkering
It
down,
happens.
and our folks who were trying to interview just couldn't find them. It could have been that year. So, yeah,
Yeah.
because it's one day, and you really have from dawn for a few hours. And if the weather is not amenable, people just are staying hunkered down and not coming out. It might have been 4 years ago, but I can't swear to that, so.
Yeah.
One more thing. So I guess what I was ultimately getting to is, 2.3 million, we have 75 on the 1 day count, but is there other cities of similar size that have a smaller percentage based on their overall population, and then what are they spending? And
Through the mayor, councilman, we're doing well. Our count is low. I mean, if you look at the cities around us, you'll see a much larger street population. I think that's about our ability to stay ahead of it. As I see the street, first of all, one thing to note is that that 75 are only the people that were on the street that day.
Mhm.
It did not count the people that were in shelter. So our shelter is almost always full, if not always full. So our shelter beds would have been full that day. But what we try to do is, like I said, stay ahead of it. This is why we've recently brought on additional navigators where we, like you, can see that the numbers on the street, for whatever reason, for lots of reasons, are starting to rise. So we've been talking about, hey, let's get some more navigation services out there. But in the end, it's all about affordable housing and about housing with services. So we have to when we look at our housing portfolio, we have to be keeping this population in mind. Housing is the reasons some cities stay ahead of others, because they have somewhere for people to go. We could have all the navigation services in the world, and if we don't have ultimately have somewhere to go, it won't help us. Another thing I really think we're going to need to look towards in the future that Leah is going to talk a little bit about is the mental health of the population of both homeless people and in general, and making sure that we take action early and not let that get out of control.
Okay, thank you so much.
Yeah,
Appreciate
you're
it.
welcome.
Councilmember Stewart. That was a throwback.
This is where he sat?
Could have, once upon a time.
That's a flashback to like, you were thinking about 2015 and the low count.
There you go.
Councilmember. I was gonna ask, we've got a neighbor next door, Gilbert. Do we have any idea what their count is right now? And they're a very similar, city.
I should have looked before I came through the mayor, Councilman Stewart. It's generally lower. But we're good friends with our colleagues in Gilbert, and they actually learn a lot from us. They are now about to hire their first homeless navigator because their street population has increased. And I live in South Chandler on the border there, and I have physically noticed that the population is absolutely increasing in Gilbert. And so they have followed our lead. They're hiring their own navigator. They're starting with one. They also followed our lead with what we did with our CDBG CV funds that you made sure that we allocated very quickly. They increased their eviction prevention immediately. And they just recently opened within the last year their new Heritage Center for social services, also through Ascend. So they're experiencing the same things we are. They're usually a step or two behind us. We like to help them along.
Councilmember Orlando, then Councilmember Wong. A really thorough presentation. Thank you very much. I like how the fact you also covered the misperceptions of what's going on out there, the communication. I mean, there's another misperception. The more service you provide, the more homeless you could have. And I know there's statistics that don't bear that out. So I'm glad you were able to address that. But so we have 75 homeless roughly. You have a program that is pretty aggressive program. Do we expect to see those numbers to go down, or you truly believe maybe they'll go up as fast?
Through the mayor, Councilman Orlando, first, we probably have many more than 75 people who are experiencing homelessness. That's just what we were able to capture in that one day.
Got it.
So that's important to know. We believe in all of the research. Research is coming very quickly now about our ability to prevent evictions and what's going to happen to people when the evictions occur. Our shelter capacity is absolutely tapped across the valley. There is no more shelter capacity. So for those of us who do this work, we are right now talking to our partners like churches, et cetera, saying, if people start to end up on the street, are you willing to open your doors? Because we think this year is not going to just go with the trend. It's going to go like this. We know that the economic impact of this crisis has not hit us yet, at least in the homeless arena, but it's going to come. And we really do believe we're going to have a 30 or 40% increase in homelessness in every city in the valley, including ours, unfortunately.
Yeah, unfortunately.
Yeah.
Speaking of census, do we take a census?
So I should let Leah speak to that. She is the census guru. There is a homeless specific census, and I'll let Leah answer that question for you if you don't mind.
Take that one. So then the other thing is homeless court or mental illness court. Are we working with our city court to do that, or is that something Leah's going to address as well?
Yes, through the mayor, Councilman Orlando, yes, Leah is going to address it. We have been at the precipice wanting to implement a community court. We already have a mental health court that's very successful. We are ready to open a community court, and it's one of the future strategies Leah will present.
And are we working with the magistrate on that as well?
Yes, sure are.
And does funding come with that by any chance?
A need for funding comes with that. And we believe that the court believes that there is maybe some cost on their end as well.
Okay.
And we do have a slide that will give you our estimate for that coming up.
Okay, thank you. Thanks, Mayor.
And I believe Judge Fuller's been involved with
Yeah.
the homeless court in Phoenix before he came here,
Yeah.
so I know that's been on his
Yeah.
list. So, Councilmember Wong.
So in the past, we had the city sometimes offer some funding for private nonprofit company and provide some shelter. My question is about shelters. Yeah. So in the past, the city may provide some fund to nonprofits and to help them build shelter or even help their operation, etc. And do we have anything that is operated by the city or city funded but operated privately? Do we have anything like this? And if I guess we don't have, but I could be wrong. But if we don't have any cities in Arizona or even other states have been using this model?
Through the mayor, Councilman Wong, we do not have any city-owned properties that we run shelter with, but we do support nonprofits within the city of Chandler that provide emergency shelter. Also, we support nonprofits with grant dollars in our surrounding East Valley cities that
But
provide
it's not
shelter.
totally funded by city. It's just like we provide assistance, we give them
provide
money
assistance.
and then operate.
right.
And they will need to, if they don't have enough money, they will need to get from other sources, right?
That's right.
Okay.
The city of Phoenix previously, at one time, had a shelter, and they got out of that business because the maintenance and operations of that kind of building becomes quite a thing.
Mhm.
Yeah, and it's easier to let the professionals who are in that business in the nonprofit world run that operation.
So they found out it's more cost effective or cost efficient that let the private company run it instead of the city run it.
Correct. It's more cost efficient to let a nonprofit organization.
And this is some part I never
that work?
understand. This is some part I never understand. If those private company can make money, how come the city cannot save money?
Through the mayor, Councilman Wong, generally those kinds of operations are, they don't bring in profit. They're run by nonprofits, and the nonprofits have to get multiple sources of funding to make the operation work. And those funding sources that fund them only will fund a nonprofit. They will not fund a for-profit organization.
Okay.
So sources are just not available for a for-profit organization.
Got it. So can I confirm that you are telling me there is no for-profit company running this kind of public shelter?
I have never encountered a for-profit organization that runs a shelter.
Okay. Thank you.
You're welcome.
Any additional questions for Ryan? Councilmember Rowe.
Thank you, Mayor. I'd heard that we have some studies that disprove the idea that the more services that you provide, the more homeless people you're going to be requesting those services. Is that true? Is there some study that says that's just not true?
Through the mayor, Councilman Rowe, I do not know of a study that actually says that. What I do know from in my experience is that, and certainly has come true here in Chandler, is that most folks stay very close to home. They don't leave their community of origin for services. So I don't personally believe that building more services or offering more services attracts people from other places, because what keeps people in their place is their sense of home and their sense of community. So most of the folks that we work with who are chronically homeless in our community have been here their entire lives. So that's not, that's not 100% of the time, of course, but the folks that are really chronic were born and raised here.
I think you gave a good presentation. I think we should be careful about being over welcoming. I think providing services is a good thing because we definitely have people that are in need. There are more homeless people in Chandler today than there ever have been. They are evident when you're driving around the community. And I'm very excited about hearing about the regional vouchers because it would seem like some of our programs are somewhat hamstringed by the federal government. So when you want to try and do what you think is right, the federal government, while it may give you some money, prevents you from doing what you want to do or doing what's right. So
There are many rules and regulations.
anyway, thank you for your presentation.
You're welcome. I'll turn it over to Leah.
I'd just like to follow up a statement is that I do think it's what we're searching for is right sizing, how do we address ours? Because again, with the SPDAT process, if there are resources, beds, whatever available in any community, the rest of the community knows that through the SPDAT and will also recommend. So it is key and crucial to me that we right size as well as make sure that we prioritize, our organic homeless problem that's going to be rising through the, if we find a greater, what you had mentioned, 30% increase because of the housing situation. So we're certainly not large enough to take on the woes or the concerns of the Maricopa County.
Thank you. One thing I want to add at this point, I know Ryan talked a couple times about the number 75, that's our point in time count. But what that doesn't capture is the number of homeless students in the Chandler Unified School District. Typically, there are over 500, an average of over 500 homeless students within the district. And we're maybe going to get 1 or 2 families on our point in time count. So none of those students are really being captured. So I think it's important to keep that perspective in mind because we also are talking about families here too. And as Ryan said, families are really undercounted. Lots of times families are trying to stay hidden more. They may be jumping around from place to place, but that's a number itself that is really undervalued in the point in time count. You just don't capture that. So I thought it was important to point that out. One of the things that
Councilmember Rowe.
Good point, Leah. The question that I have for you about that point is that aren't a significant number of those youth foster children?
Through the mayor, Councilmember Rowe, I'm not sure what that number is, but we can certainly get that for you. Some of those be foster children, but typically not. They're usually, families are considered doubled up a lot of the time. So it's one family that's been displaced that's living with another family, or they may literally be out on the streets. But most of the time, the foster children, I believe, are being counted in as part of the household. But we will definitely confirm that for you.
Yeah.
But most of that are displaced families.
Yeah, the last I knew, foster children are considered homeless and they are
okay.
part of the
That may
count.
be.
So to
No?
me, it's,
Yeah. We
well,
will confirm that for
yeah,
you.
that would be good to know. Thank you.
Yes.
And
thank you.
Leah, that 500 really, it's real, and I know that, but they're not generally chronically homeless, meaning they're not sleeping in an inhospitable place. They're couch surfing or, as you mentioned, doubling up, which is, again, hard for a student and hard for a family, but they're not on our streets, correct, for the most part.
Yes, Mayor, that is correct. Absolutely. We find very few that are on the street when we do the point in time count. We do know that there are family shelters in Mesa, for example, that the city does provide funding through our general fund. And we do have some families that are placed there as well as other shelters across the valley. But right now, for example, there is an 11-week wait for families to get into shelters. And I do want to address Councilmember Orlando's question, if I may. Through the mayor, Councilmember Orlando, there is a special homeless count as part of the census that's to take place beginning on September 22nd. We have reached out to census staff a number of times because We don't know that the enumerators are necessarily going to know where to find Chandler's homeless population. And we will also follow back up with our navigators the week after. And if any of our homeless population has not completed their census, we will make sure that they do complete their census. So wanted to let you know that we're being very aware of that situation and making sure that we do get as an accurate account as possible through the census. So. All right, future strategies. As Ryan talked about, really housing is at the crux of all this. As she said, you know, we can have great navigators, but if we ultimately don't have a place to put people, then we have a challenge. And as you know, we've brought this to your attention before, especially when we've talked about the rental assistance demonstration program with public housing. We have a need of over 9,000 affordable housing units over the next 10 years. So certainly the city is not in a position to supply 9,000 housing units. We want to make sure that we are part of conversations that are happening as far as other alternatives. Diversifying affordable housing options. So an example of that would be density bonuses, let's say. In some communities, there are density bonuses. So a developer is going to come in and build a certain number of units, and they want to go higher than maybe what's typically zoned. The deal is that a certain percentage, let's say 10%, would be used as affordable housing options. Looking for innovative solutions that are not necessarily on the city's dime to be able to address that is one of the things that we feel it's important to be part of that conversation. Our rental assistance demonstration project, as we've brought to you just recently, our RAD program, where we're going to look at redeveloping our own public housing and be able to add a few units through that. So that's certainly something we're moving ahead with. And then the regional vouchers, as Councilmember Rowe alluded to. This is a conversation that Chandler is having with Mesa, Tempe, Maricopa County representing their portion of Apache Junction, and Scottsdale, to talk about that there are opportunities through HUD to apply for vouchers that can be used in a number of different cities. So they work very much like the Section 8 voucher, but they're transferable between cities, which again, in our community, we need to be able to offer more options because we don't have enough of affordable housing here or enough landlords that take Section 8. And so this would provide us with the opportunity to house more people. They may not necessarily be in Chandler though. And then the investment in permanent supportive housing. Again, another regional conversation that's taking place in the East Valley. There may be an opportunity in the future where there would be a new permanent supportive housing service project built, and this would give us an opportunity to be at that table and have that conversation as to whether Chandler could be represented in that and our residents have permanent supportive housing. As Ryan talked about, this is an extremely important piece. We even see this in our own public housing residents. From time to time, we will have residents that are not successful in public housing because they do have some of the same challenges as our homeless population. Maybe it's behavioral health problems or challenges. And so they actually are a better fit for permanent supportive housing. So it's something that we are certainly aware of and deal with sometimes in public housing. And so even just the services themselves could benefit not only the homeless population, but we may have services that could benefit our own public housing residents.
Mayor. Vice Mayor.
Can you expand upon what you mean by permanent supportive housing then?
Yes.
Is this, because, I mean, expand upon it, because you mentioned an issue, but it almost sounds like something that is, I hate to say forced, but something that, again, is a requirement, but people wouldn't, they'd have to agree to stay still.
Through the mayor, Vice Mayor Lopez, permanent supportive housing provides those wraparound services that are needed to keep somebody successfully housed. So an example I have is one of our clients that we worked with the tenant-based rental assistance. He had severe mental illness. He had a behavioral health team, but because the behavioral health system is so overworked and taxed, his team wasn't getting to him. With him, the solution was as simple as making sure that he took his medication twice a day. And he came to us under our homeless navigation services because that's where we found him. And eventually we were able to transition him into permanent supportive housing. But for that couple years, it literally was our navigator calling every morning to say, hey, did you take your pills today? And then one of his case managers with the behavioral health side made the call in the afternoon. But if that didn't happen, he would fall out of housing pretty quickly. He'd have other people that would move in with him. He would have people who took advantage of him. he would have a pretty steep decline the moment he stopped taking medication. So that's just one example, but it's whatever those services might be to keep somebody on track. Another one I've seen that we've encountered is people who have challenges with hoarding. We've had a navigator that would go in there and make sure that they were not hoarding and stop the hoarding before it begins. That's another piece that could be a part of permanent supportive housing if that was the type of service that somebody needed. So it would just be that wraparound service that keeps them successfully housed.
So, continuing that question, so does that mean that the individual is paying for that housing and we're providing the wraparound services? Is this, again, through CDBG funds, providing them the housing? Are they in Section 8 housing and it has the wraparound funds? I guess I'm still trying to figure out, what their involvement is. And again, like, for example, like you said, the first example with the medication, if he refuses, yeah, I'm done. It clouds my mind as a lot of, again, unfortunately, behavioral health and mental illness medication. Sometimes the cure is not as satisfying as being off of it for some of those experiencing mental illness. When they're on it, they feel in a cloud. So sometimes they want to stop. And does that mean that they get removed from that permanent program because they're unwilling to abide by certain rules? Again, is there requirements behind that? And once they are stable, does it mean they are then working and providing and paying for the housing? How does that program work?
Through the mayor, Vice Mayor Lopez, there's actually a couple different models. Sometimes the services are provided by the same entity that owns the housing, and the voucher is in a apartment complex, multifamily unit that has the services right on site. So they're providing both of them. Sometimes you might have the service that is, like you said, somebody living in a Section 8 voucher that could be with a private landlord or somewhere else, and the service is following that person where they live. Certainly there are challenges that when you're working with a population that requires this level of service, that there are many things that could cause them to be not successful in housing. For the most part, the service is going to try very hard to follow that person and keep them housed, especially if it's a service that's behavioral health based. They know that there's going to be stumbling blocks, and they're going to work very hard to try to keep the person housed. It's going to depend on the type of program as to how quickly somebody could get evicted, let's say, based on the behavior. And so that will play into it as well.
I guess my hook in here, last question on this, you don't want to beat this one, but the permanent part. Because when you talk about permanent, again, somebody gets enrolled in a permanent supportive housing. Again, what is that limit? Like you said, if they say no, I'm not doing this, I'm not doing X, Y, and Z, do they then get removed so it's not quite permanent, or is it, again, where does that permanency come in for the statement?
Through the mayor, Vice Mayor Lopez, the permanency is usually in the voucher itself. So for example, with our tenant-based rental assistance program, we supply up to 24 months of rental assistance. It's not a permanent voucher. The permanency is in that voucher that for the most part, they hopefully will be able to keep in perpetuity. Obviously, there are some times that might go to extreme cases and a person might end up getting evicted, but for the most part, that voucher will stay with them. If somebody, again, depending on the reason they got evicted, was to get evicted, depending on the type of voucher, that voucher may still follow them into, say, a new apartment. So the permanency is, as long as they meet whatever the criteria is for that voucher, they'll continue to have that voucher.
So the permanency is more for that supportive wraparound services, and not necessarily the permanency of the housing. Would that be more
Exactly.
accurate?
It's
Okay.
not necessarily that they're in a certain apartment, but it's that they have that service as long as they comply with, to whatever level the guidelines.
Okay, thank you. Yep.
Sure. So that's something we certainly want to keep in mind, because we know we have individuals who are experiencing homelessness that definitely can utilize these services. As Ryan mentioned before, she talked about one couple and the barrier with pets. We'd have to continue to explore this, because pets can be a barrier to get people to go to maybe fill out an application for something, or whatever the barrier is to keep them from being housed, whatever that next step is. Often people are not going to leave their pets, so they're not going to go into a shelter because they don't want to leave their pets. I wanted to point out, we're going to call her Betty for today, but we'll call her Betty, although I'm sure some people in the room recognize exactly who this is. This is her picture of her 76th birthday that happened in August. Betty was born on the old Bogle farm by a midwife. So she has been a Chandler resident for 76 years. She actually was stable for a long time, grew up in historic South Chandler. She had a job with Maricopa County. The story on the street is that she went on vacation to Hawaii for a week and disappeared for 3 years. And then when Betty came back, Betty was homeless and continued to be homeless for years and years and years. Betty has a dog, Mr. Weddle, and there is no way that she will ever leave Mr. Weddle. Mr. Weddle is always by her side. Some of you may know her. She was along Delaware Street with some tents for a few years, took up residence at Foley Park more than once. Betty tends to attract other people who are experiencing homelessness. She cooks for them, is a very generous person. Betty is now housed. We have her housed. And it just goes to show you that, you know, with a pet, there is no way she was going to go into a shelter or go anywhere. And she would rather be on the street homeless since the 80s than to give up her pet or her, in her mind, her way of life. But being able to get Betty into housing has helped really disperse some people from the park in addition to Betty. It also has helped others to see that this is a person they've trusted because she's been homeless in Chandler for all these years. If it's okay for her, then it's okay for us. So again, looking at that pet situation, being able to find that solution, and it goes beyond pets. It's whatever that unique situation is. Being able to address that is something that we continue to look and explore for solutions. Adding the year-round day respite center is another example of that. Ryan talked to you about having people come in. I know in particular, Jeff Williams with the Salvation Army shared a story with me that there is a man that he's been trying to talk to for 3 years, and the guy would not give him the time of day. He went into the respite center, and within a couple days, they have him on a pathway to rehabilitation and then ultimately into housing. Conversation that couldn't happen for 3 years happened in less than a week when he was taken into a setting that was low barrier. So we definitely want to continue to explore this. We think there is a need for it year round because it has been such a great catalyst to getting people to come into services. You know, as Ryan said, this is a very service reticent group. They are not here for service. This is not what they don't want to be bothered when they're on the street. So if you can get them to come in to something like a day center, then that conversation can start. Implementing community court. It is something that we're looking at, whether it's a community court model similar to what the city of Mesa has, whether it's an expansion of our mental health court here. This is something that the city is discussing, certainly with Judge Fuller. The idea behind this is that there's a portion of our homeless population who has very repeat visits with the court system. Recently, we actually heard a story of a woman who went to Circle K and she stole a beer, and then she went and sat out on the bench, the bus bench, waiting for the police to come arrest her. Well, it was in the middle of summer, or not in the middle of summer, it was in August, and she was hot and she didn't want to be outside anymore. So her idea was, if I can go to jail, then I can cool off for a couple days. Our officer was astute enough to know about the day center and took her actually down the street to the day center. And then again, this is somebody they got on the pathway to rehab and into housing. But the same concept is there with community court. We know that our people who are experiencing homelessness, sometimes it's just survival skills. They're hungry. They might steal something from Circle K, for example. They've got it's a revolving door of misdemeanor crimes that are going through there. And what the courts can do is they have the ability to really make that an incentive to go to services, and the courts can help design what that plan is, along with the prosecutor's office and the navigators. And the navigators are key in this, in figuring out what that pathway is for the person, and it gives that person incentive to work through whatever that path is and go to services, which again will help them get off the street. So we're having those conversations. I will show you in a minute what we think the cost would be from the navigation standpoint, but certainly the courts would have additional costs on that. And then finally, the behavioral health specific response. One of the things that we encounter on a regular basis is a lot of our chronically homeless individuals really have extreme behavioral health issues. And sometimes that makes that group even more challenging than some other people who have shorter bouts with homelessness. We have also seen, and I think all of you have heard, some complaints from time to time along Arizona Avenue, for example, of people who appear to be homeless. Well, some of them are not homeless. Some of them are housed, but because of the behavioral health issues they have, they are hanging out with people who are experiencing homelessness. And causing some of the same challenges. So this is something we want to explore is can we bring in some more behavioral health specific resources and also maybe even look at addressing behavioral health individuals that are not necessarily experiencing homelessness but are causing some of the same challenges and a demand really for police and fire services. The immediate challenges, as Ryan alluded to or talked about, we have limited funds to prevent eviction. We don't really know exactly how soon everything is going to play out. What we know is that because of the moratoriums, we're seeing a delay in evictions. But what's important to understand is that in order to not be evicted under the moratorium, it does have to be COVID related and provable, as Ryan had talked about. There's the other pieces of the plan of making sure that the tenant is applying for the resources, going through the CAP office, communicating to their landlord, and setting up some type of repayment plan. What we know, because we're hearing the stories, is that not everybody is following those 4 steps. So we're going to continue to have people who are going to be facing eviction and can be evicted because they're not following the regulations that go along with the moratorium. And then you couple that with the fact that some people have had challenges since back in March and April with having rent paid, and the moratorium lasts through December. Right now, people can get up to 6 months of service or of rental assistance, but that's not going to be enough. So we have a concern that whenever the moratorium ends, we are still going to have a group of people that are going to experience evictions all at the same time. And so that really brings the host of everything else with it. We will need additional funding potentially in the future to prevent evictions. We already know there's reduced emergency shelter capacity. So if people do get evicted, where are they going to go? They have limited housing to be able to move back into, and then it's just going to increase the number of people on the streets. And with those challenges, the way that we're going to be able to respond, a lot of that is with the bridge housing that we've already talked about. The use of the motels will be one of the things. And then, of course, the limited access to direct services. Once somebody becomes displaced, it's much harder for them to get connected into services. Okay, so here's where the dollars come into play. The good news, I promised you good news. So the good news is that we've just learned that we are going to receive just over $1.5 million in CDBG CV3. This is round 3 of those funds. So we will be receiving those dollars. So that changes the conversation a little bit tonight. I will point out what we feel like we can use that money for. The first thing, Community Navigator Program. We do feel like we'll be able to use some of that funding for this, but I think it's important to know that we've talked about Misty, for example, being a city employee, but you need to know that she is a temporary city employee. She is not a full-time permanent employee. So eventually, when funding runs out, whether it's through CDBG, CV, or whatever funds, we come back to that $58,000, which doesn't even pay for a full navigator. Just something for you to keep in mind for the future, that somewhere down the line, we've got to address what's our appropriate level of navigation. The motel stay bridge housing, we do feel like we can use a CDBG CV for that, so that should help continue that program. Same thing with the rent, mortgage, and utility assistance. However, remember, it has to be COVID related. And really the same thing goes with the bridge housing. So we will have to see how well that's going to work because it will have to be for COVID related only. And are we going to have some families that are falling out through evictions that are not COVID related? Rapid rehousing, same thing. The idea is to be able to quickly get people rehoused. As you know, we gave funding to Save the Family to have 19 units that currently, when we use the AZ CARES money for that, to quickly rehouse families. We want to be able to continue that. The day respite services, as I said, this is something that we can look at using the CDBG funds for, we think, but we're not 100% sure because, again, that COVID related piece, it's something we're going to have discussions with HUD to make sure that we are able to do that. The landlord incentives and mitigation fund, probably not something we can use with CDBG CV. And the reason that this is so important is that we need more landlords to take the Section 8 vouchers, for example. We struggle at times with not having all of our vouchers utilized because we don't have enough landlords. And we want to be able to educate landlords. Some of the other cities are doing this. Phoenix, for example, is providing $500 for each landlord that comes onto their Section 8 program. We don't anticipate going that high, but we want to look at doing something similar where there is an incentive to come onto the program. And then the mitigation fund would allow, I think would help with there's I don't know, I guess a stigma that can sometimes come with the thought of taking a voucher from through these programs, and the fear that, well, somebody's just going to come in and destroy my apartment, especially when you're talking about housing somebody who may have been homeless on the street for years. The mitigation fund would allow us to have money to be able to say to the landlord, we will pay this much above the deposit should there be damage. Most of the time you don't end up needing to use the money, but it gives that incentive to the landlord. So those are the things that we want to look at doing with this fund. And then finally, the community court navigator or homeless navigator navigation piece. This is also something we will not be able to do with the CDBG CV, but as we develop this program with the courts, there would be the need for an ongoing navigation service to accompany whatever we are able to develop with the courts. And with that, I would entertain any additional questions.
So I've got a few, and I'm sure there might be others. So are some of these positions like a full FTD, full employee, the last one in particular, the court navigator? Is the vision for that, or is that a partial employee? I'll start with that question.
Sure, through the mayor, Mayor Harkey, yes, we would envision, we know by experience that we have been much more successful when we hired Misty on even as a temporary city employee versus contracting for that service. When we contract for the service, we lose some of those hours each day. They have to report to Phoenix at the beginning of the day, end of the day. They have to do the training that Phoenix, whoever the nonprofit that we're contracting with, just different things like that. Not as much control of the schedule. What we found is that we get much more efficiency when we hire the person. And as you asked, right now, Misty does work 40 hours a week, but it's not a full-time employee. She's not an FTE. She's considered a part-time temporary employee, even though she's working 40 hours a week. We would like to be able to institutionalize that, of course, in the future and see about having a full-time employee, our regular positions for consistency's sake. And it does work better for us on the navigators. For the court navigator, however, we probably will want to contract that with CBIs who we contract with now, because there's additional resources that they can bring to the table with that. So that one, I think we would look at contracting out.
Mayor.
City manager.
Yeah, I apologize for interrupting, and Lee is exactly right. But I think to caution in the discussion is we don't want to build a program around what's happening this year. We want to build a program around something that's sustainable based on what typically is occurring in the city. So to your point and about the FTE count, that would be something we would really have to look at very closely, because we might want to do a portion of that with one-time dollars first to see if it works. And second, because we don't know what's going to happen come a year from now and what the program really might need to be. So just as a word of caution on those numbers. But certainly today, what Leah is talking about.
Yeah. My question really was less contract versus employee. Is there a demand in the court for a full FTE, or would that be a shared responsibility, perhaps a hire with other responsibilities in the court concerning specifically this? Could it tie in with some of the other court type things? But I was more referring to that rather than contract.
Mayor Harkey, that's something we certainly will explore with the court, absolutely. Whether it's a combination, if it's a navigator, part of the time may be spent out on the street and part of the time would be spent working with the courts. It just depends on what we feel like the volume is going to be and the number of cases. And to piggyback onto what Marcia had said, and absolutely, we are not talking about next year. We're talking about, we know that we have funding to keep these positions going, the navigators specifically now with the new CDBG funding for a couple years, or at least for one fiscal year after this.
So really the ask conversation is really planning, looking at 21, 22 for the quest as a baseline. Is that more of the conversation here, is to inform us of how do we continue with these programs as opposed to needing these dollars next month or January next year?
Mayor Harkey, yes. So it's a combination. We know we'll be coming back to you very shortly now with a CDBG CV plan. And so that ask will happen sooner rather than later.
Sure.
And then the other piece of it is looking towards the future, and whether it's 21, 22, somewhere in there, depending on which service we're talking about and what CDBG CV cannot cover. There could be an ask during the budget process through the future, for the future. But we will be coming back to you for CDBG CV requests fairly soon.
Council questions? Wow, you've done an amazing presentation between you and Ryan, and
Yeah.
seeing no questions, I'll close this work session, and why don't we meet a couple minutes after 6? So we'll give us about a 7-8 minute break. Well, good evening and welcome to our regular city council meeting of September 17th, 2020. I do see Councilor coming in, gave a few extra minutes. Clerk, please call the roll.
Mayor Hartke,
Here.
Vice Mayor Lopez,
Here.
Councilmember Stewart,
Here.
Councilmember McClymans,
Here.
Councilmember Wong, Councilmember Rowe,
Here.
Councilmember Orlando.
Here.
We have a quorum.
Thank you. Our invocation tonight will be brought by Pastor Ryan Arneson of Redemption Church and our Pledge of Allegiance by Councilmember Jeremy McClymans. Pastor.
Let's pray. Father, I thank you for the people in this council that represent the city of Chandler. Thank you for Mayor Kevin Hartke, Renee Lopez, Terry Rowe, Matt Orlando, Mark Stewart, Jeremy McClymans, and Sam Huang. Lord, thank you for the distinct privilege you have given them of serving the city, the people of the city of Chandler, not just the systems and structures, but the people. I pray that you would be gracious to them and give them all the wisdom and patience that it takes to see your perspective on what you're doing in the city of Chandler so that they can take action accordingly. We ask you that you would lead and guide them in this meeting tonight. In Jesus' name, amen.
Please join me in reciting our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Pastor Arneson. Thank you, Councilmember McClymans. Council, tonight we have a consent agenda and one action item that was brought to action at our Monday meeting. Regarding our consent agenda, what is your pleasure?
Mayor.
Councilmember McClymans.
I move to approve consent agenda items for tonight's meeting, September 17th, items 1 through 31.
Second.
Second by Councilmember Rowe. Any questions or comments?
Mayor.
Vice Mayor.
I just want to throw a special thank you out there to, again, more of the citizens that have volunteered to serve on our boards and commissions. We need you. Thank you for stepping forward, and we need more of you. So if you're watching out there, please go to our boards and commission website and see how you can help out your city.
Thank you. Council, seeing none other, please vote.
Motion carries unanimously.
All right, thank you, City Clerk. We have one action item, and this was brought to action by Councilmember Stewart. Councilmember Stewart.
Mayor, thank you very much. And I'm glad I brought this up on Monday. We got a lot more information from staff, and I want to thank and commend them for the work they've done. You know, in the past 72 hours, you know, I know that staff has reached out to a number of the STR ownership groups like Airbnb, Expedia, such, and gotten some information from them. It sounds like some commitment from them to communicate to STR owners their responsibility in being good neighbors. And they're going to share with those homeowners that that is going to be the case. So thank you for doing that, Ryan. I appreciate that. And more importantly, I had a conversation with one of the neighbors, Mr. Ryle, for about 20 minutes earlier today, and we talked specifically about some of the challenges that neighborhoods are facing with, one, adjusting CC&Rs, and then two, managing bad actors. And so fortunately, I think this ordinance, in the way it was set up, is going to do some great things to help move the needle and give the homeowners association and owners in those neighborhoods the ability to do some things. So Mayor, I'd like to move that the council tentatively adopt ordinance 4939, amending the city code of the city of Chandler by adopting and adding chapter 22 short-term rentals. From that, it's my expectation upon that adoption on October 12th, staff will immediately be able to get to work in informing the public and the short-term rental property owners in Chandler of this new law and its ability to help outline tonight's presentation. So I think Ryan's going to present some information about it as well.
So I'd like to second that. And are you requesting a presentation from Ryan, or are there specific questions?
Interesting, right? Can you talk about all the different levels of education you're going to provide to the community, which was my biggest concern, was making sure that we got the word out there, which you already were ahead of it, but we just didn't have it in the presentation on Monday, so I appreciate that.
Yeah, I'm happy to. Mayor, council member, let me skip ahead. I was going to give a lot of background for the benefit of the public that was not able to view the meeting on Monday. Just to set the stage, we're talking about implementing House Bill 2672, which created a verified violation process and really creates that balance that we had talked about with ensuring that property owners have some rights as well as the neighborhood has some rights. And one of the issues that Councilmember Stewart had brought up was ensuring that the property owners have a way to know about this new change. And so we had talked about it since Monday as a staff at the various communication channels, in addition to our traditional social media and others. I've had some contact with VRBO, specifically expressing an interest in helping us get the word out. Our staff is committed to ensuring that through these other channels that we talk about up here, either direct contact with the vacation rental property owners, the platforms themselves, and the property management groups, utility bill newsletter, that will ensure that that goes out, so that will touch the residents and the property owners. We're going to broadcast this on the website, as well as social media, and using Nextdoor and traditional news. So with that, we think we have a pretty comprehensive way to get to the property owners, and it's my understanding that there is some tracking that already exists where there have been touch points before with short-term rentals, although not a formal tracking. We're going to work and see if we can look in that database that we have already and ensure that those folks that have received visits from our law enforcement in the past, make sure that they get extra special attention that this is coming. So does that answer your question, Councilmember?
Absolutely, and I got to commend you for taking the bull by the horns and working on that Tuesday and already having information back. That's a testament. It's pretty typical of Chandler, so thank you.
Well, thank you, Councilmember Stewart, for digging into this a little bit more. Council, additional questions or comments?
No, Mayor.
Councilmember Orlando.
Mayor, I just want to thank again Ryan and your staff, as well as the residents that have written and called in their concerns about this. And I think this is a fair ordinance that I think will help us educate, but then again, have a little bit of teeth in it for those bad actors. And as I spoke Monday night, we have a good actor in our area, and we have one that's probably not going to get, probably going to get knocked on the door eventually and hopefully clean up their mess. So it's good stuff. Thank you.
All right. I'd also agree with that in that we've been receiving comments from some of our community for months, if not years, asking us to help them with this. So I'm grateful, Ryan, for your work and advocacy both in our city and beyond to help get this across. So, Council, seeing no additional comments, let's vote.
Go. Did it go?
Do we need to redo it again?
Did it work? I've got most of them.
Okay. Who have you not heard from?
Just you, Mayor.
It was blue when I hit it.
Motion carries unanimously. Sorry,
All right.
it was blocked.
Man. And I see we have no unscheduled public appearances tonight. No cards turned in. All right, with that, we have current events, which I'll start. First of all, happy birthday, Councilmember Stewart. Someone in the city thought of you and provided one piece of cake for all of us to split, I see. But beyond that, a couple reminders. Today, the last day to vote in the November general election is October 5th, so it's right around the corner. So we encourage all of our community to register at this time and to make sure that you're qualified and able to vote. Early in person and by mail voting will start October 7th. Chandler does have one item on the ballot for residents concerning a franchise agreement with Southwest Gas Corporation. I believe all of council, if not all, almost all, has participated and will be, actually we'll have a letter advocating for this. I believe the chamber is as well, that will be promoting this. With this particular ballot item, the agreement will allow the utility to construct, maintain, and operate its natural gas system in the city-owned public right-of-way. Want to commend staff again for your work with Southwest Gas to make sure that we are looking out after our ratepayers and our community from any unanticipated expense. And I kudos to our staff. So to learn more about this item, key election dates, and how to register to vote, please visit the city's website. So with that, birthday boy, Councilmember Stewart.
Thank you, Mayor. I appreciate that. And I noticed that 1 year older, the font on my paper here that I'm going to read is a lot larger than it was the last time I was here. But hey, happy birthday to Lauren Cole, who shared her birthday cake with me. We share a birthday today, so she's in our she's in our neighborhood services department. And so thanks, Lauren, and happy birthday. So hey, just a reminder, your census is due here pretty soon. We're running up against the deadline on September 30th. It looks like that's going to hold firm. But the great news is that we're moving forward and more people are taking the census. And so to encourage participation in the census, the city of Chandler is doing a gift card giveaway. Random people will be selected that have taken their census. All they have to do is go on our social media channels, say, hey, I took my census, and you'll be one of several winners of gift cards from several of our local businesses. So keeping that economy, that local economy moving. So please, please, please complete your census at mycensus 2020 or my2020census.gov. It's on the screen. Thanks very much, Mayor.
Councilmember McClymons.
Thank you, Mayor. The more than 500 applications have been initiated by Chandler businesses seeking support through our I Choose Chandler business hiring and retention program since its launch on August 17th. To date, approximately $2.4 million have been approved for 312 businesses in Chandler. And last week, the I Choose Chandler business hiring and retention program expanded to include additional 5 business industries, which are construction, professional, scientific, and technical services, wholesale trade, educational services, and other services. Businesses within these industries can apply to receive $1,300 per full-time employee retained or hired since December 31st, 2019, and you can receive up to a maximum of $10,000. Qualified businesses can apply on Arizona Community Foundation's website. Get your money. Thank you.
Vice Mayor Lopez.
Thank you, Mayor. So the city of Chandler is also asking the community to participate in a diversity inclusion survey to gauge community awareness and involvement. The survey is open now and will be open until Wednesday, September 30th. Once the survey has closed, the Human Relations Commission will review the results and provide recommendations to the City Council in November of 2020. To learn more, please go to the city website and please get involved in our community. Thank you.
Councilmember Wong.
So it's September now. Temperature is starting to cool down very soon.
Aspirational.
September is a library card sign up month. You can sign up, you can get a free library card at any of our 4 Chandler libraries location with your picture ID. All Chandler libraries are now open, in case you don't know, with limited capacity. But reservation and time slots are required to visit the library in person. Okay? So you can visit Chandler Public Library for more information. That's it. Thank you.
Councilmember Rowe.
Thank you, Mayor. Happy birthday, Councilman Stewart, and good luck on your weekend this weekend, Mayor. And COVID, it does seem maybe like the dust is beginning to settle just a little bit. So there is a chance for some optimism, and so let's continue to be considerate of each other. And to our public safety professionals out there and people that are working hard, thank you, thank you, thank you. You have my support, and that is all. Thank you.
And Councilmember Orlando.
Thank you, Mayor. As you know, throughout the years, Chandler has been a strong member of the National League of Cities. The National League of Cities is an advocacy group that municipalities throughout the United States use in order to advocate on behalf of the cities and towns. Several of you, many of you in this have served on committees. I know currently Councilmember Stewart and myself are serving on 2 separate committees. And just recently, our Fair Committee, which is the Finance Administration Intergovernmental Relations Committee, had I want to say not emergency meeting, but they had a unscheduled meeting in order to promote a bunch of issues that we feel hopefully in this next CARE Act, which hopefully gets approved by Congress. And we put together a bunch of resolutions. One of them was to help small businesses, VITA, even supporting things like family assistance, expand earned income credit, so things that will help the middle class and our small businesses. And one of the things I brought up as a personal thing that to me is voting. I put forward an amendment with the help of staff. I appreciate their support on this that will help ask the U.S. Congress to support funding as well as resources to help us allow for accessible, safe voting during COVID. That resolution was passed and will be going towards the national board and then on to Congress. So thank you for the work on that, staff, and I was glad to see that we put something in there that helps our communities with voting by mail. So I think it's very important that we send that message through COVID as well as some of these other important issues. So that's all I have, Mayor. Thank you.
And thank you, Councilmember Orlando and Stewart, for serving and representing the city at a national level with this. City Manager.
Mayor, Council, just wanted to give you a 5-second update. Your Citizen Bond Exploratory Committee is hard at work. All of the subcommittees have had at least 1 meeting. I think we've got one that's had 2 already. So there's a lot of excitement building around this. And so we will look forward to reporting back with Chairman Dunn here in the next month or so.
All right. With that, thank you all. Stay safe, and that concludes our meeting tonight.